Hello, I'm Dr. Jim, and I've got a great topic, a serious topic. New corporate training. Should it include learning how diseases are transmitted? Most diseases start locally, and then after a while they begin to spread within a larger population. Thankfully, most diseases will not go past their point of origin because the way they transmit is either easy to stop, to slow down, or patient zero is known and then isolated. Unfortunately, there are diseases that have the ability to spread rapidly and widely to many people in large geographic areas. It is therefore important to continue or ramp up teaching and training employees how diseases spread. One good way to start talking about this is to teach the difference between contagious and infectious. Let me ask you, do you know the differences between the two? What's contagious? And then what is infectious? Okay, diseases that are contagious are passed from person to person through direct and indirect contact. Examples of contagious diseases include the common cold, flu, strep throat, herpes, and HIV. On the other hand, if something is infectious, it is spread through some type of agent, a vehicle. It needs something to spread, like saliva or an insect bite, mosquitoes. Viruses, parasites, and bacteria are the common causes of infectious disease, and some examples include hepatitis A and B, tuberculosis, the common cold, influenza, and SARS. Some illnesses, interestingly, can be infectious without being contagious. For instance, food poisoning. An infectious agent can make someone ill, but that person can't spread food poisoning through contact with other people. People who suffer from allergies, for instance, they can cough and they can sneeze, hopefully like this, or into a tissue and throw it away appropriately. But they can't give someone else allergies. I can't give you food poisoning, I can't give you allergies, okay? On the other hand, everything that is contagious is also infectious. Many communicable diseases are contagious, including COVID-19, MRSA, sexually transmitted infections, meningitis, hand, foot, and mouth disease, influenza, and norovirus, which is stomach flu. There are two primary modes of transmitting diseases: direct transmission, indirect transmission. Let's talk about the two. Direct transmission occurs when the infectious agent transfers from the source to a new host. This can occur through direct contact with the infected individual. It can also take place when droplets spread from one person who is infected to another person through sneezing, coughing, laughing, and sometimes even speaking close to someone. I'm probably spraying droplets all over the place right now. They're hitting my paper, the desk, my monitor, the camera, who knows? Indirect transmission, on the other hand, takes place when an infectious agent transfers from the source to a new host through particles that are spread through the air or have landed and remain on various surfaces. This can take place through airborne transmission, like this, vehicle transmission through water, food, blood, medical tools, even bedding in hospitals, nursing homes, assisted living, so on and so forth, and vector transmission, which occurs through parasites, mosquitoes, flies, and fleas. Let me give you a short story about typhoid fever, Typhoid Mary, and her real name, Mary Mallon. Okay, in 1906, on Long Island, New York, typhoid fever broke out when an unsuspecting cook who worked in a family's house by the name of Mary Mallon transmitted microorganisms, or salmonella, through contaminated food and a staff in that house who did not wash their hands after going to the bathroom. True story. Charles Henry Warren is the fellow who hired Mary as a cook, and after eating one day, 6 out of 11 people in his home became ill. Mary had cooked for 11 other families. That was her job in 1906. And that year, 22 more people became ill out of those 11 families that she was cooking for. By 1907, there were over 3,000 cases of typhoid fever with many deaths from one person. Mary was ultimately discovered to be the source and was quarantined for 2 years. After she was released, she was told there are terms here. You can't go back and do what you did and infect more people. But she did not listen. She went on to infect many more people. Now that was 1907. Let's talk about today. Although rarely seen in post-industrialized nations, typhoid fever is still a major problem and a cause of death in many parts of the world. According to the CDC, there are roughly 22 million cases of typhoid fever every year and 200,000 deaths around the globe, many parts of the world, from a disease that started in the early 20th century with one person. This stuff needs to be taught. It needs to be trained, in my humble opinion. Here's my takeaway. Businesses of all kinds will need to make a decision about the types of training and education their teams are going to receive moving forward. While universal precautions, cross-contamination, hand washing, and other related topics are very common in most organizations, training and education in the near future might include preparing for endemics and pandemics. Learning about how diseases are transmitted is a good start to this kind of training. And I've got a lot more. As a gerontologist, this stuff is frightening. You have seen that older adults who are exposed to certain diseases and they have weakened immune systems, comorbidities, pre-existing conditions, are at high risk for very bad health outcomes. Share this video, subscribe to my channel, and please keep coming back for more. Thank you. I'm Dr. Jim.